Emergency departments across the metro area are filling up with patients fighting the flu, and it appears we're not out of the woods yet.
Jennifer Leslie joins us now with why health officials are saying that the flu season is only halfway done, huh? We have several more weeks left, potentially.
Yeah, we may be close to the peak of this season, but we don't know yet. We are hearing of a slight drop in the number of cases of the A flu strain, also known as H3N2, which is the main one we've seen this season. But that's coming with a slight uptick in the number of B flu strain cases, at least among children. And remember, even if you get one flu strain, you do not build up immunity against any of the other 4 strains. We're told only the flu vaccine can reduce your risk.
So what does all of this mean for local hospitals? We're joined by Dr. Brett Cannon, Vice President and Chief of Emergency Medicine at Wellstar Health System. Thanks for joining us this morning.
Thank you for having me.
I know it's been a busy time for you, and you've been seeing a record number of patients coming into your emergency rooms, correct?
We have, and I was working last night up until about 11 o'clock, and I tell you the ERs are still very busy with flu-like cases. We've had multiple hospitals throughout the Wellstar Health System that have set records over the last 2 weeks for volume of patients coming in, including at Kennestone, which is the state's busiest emergency department and the 5th busiest in the nation.
Dr. Kenner, we had a lot of questions on our Facebook page about folks confused about when or if they should go to the emergency room.
It's a great question, and fortunately most flu symptoms can be managed at home without going to the emergency department or even an office. Reasons that you would go to the emergency department would include things like shortness of breath or any sort of confusion, nausea, vomiting to the point of becoming dehydrated, and in smaller babies you'd look for color changes in their skin or maybe a lot of irritability. Once flu starts getting better, it really should continue to get better, so anybody who gets sicker after being on the road to recovery should also be seen as well.
Wellstar has 11 hospitals across Metro Atlanta. How are you protecting your staff and also other patients who may be there for other symptoms?
Also a great question, and this isn't limited just to the hospital. These things can be done at any workplace, but number one, healthcare workers are vaccinated against the flu, so everybody taking care of you at the hospital has had the flu shot this year. Second is you may see people using a surgical mask to try to prevent some infection. Third, and perhaps most importantly, you'll see everybody is constantly washing their hands. And finally, people who are sick really should stay home. And so the health system encourages everyone who is sick or potentially has flu to stay home and prevent that transmission.
Has this affected a number of your workers, the flu?
It has. It has. Even with the flu shot and even with preventative measures, there's a lot of healthcare workers at home today with the flu.
What percentage of your staff would you say has been affected?
Oh, somewhere around 10%, and that's just a guess, but somewhere around that's probably accurate.
All right. Dr. Brett Cannon, thank you so much for joining us. And if you have any more questions for the doctor, he will head on over to our 11 Alive Facebook page to answer any questions you have. We have him here until at least 7 o'clock. So
Sure thing.
if you have any questions, head on over to our 11 Alive Facebook page for that. Thank you, doctor.